American officials are still playing at the very low end of the kinds of interventions in daily life that may be tried at some point, that may be necessary to try to steer this pandemic away from its worst-case trajectories. In recent days, we have seen Italy, for example, go from trying to quarantine the whole northern part of the country to ordering a nationwide quarantine of everyone in the country. Tens of millions of people ordered by their government, all Italian citizens ordered by their government to stay inside and avoid gatherings of any kind. Weddings and funerals banned. Well, as of today, the Italian government has gone a step further, ordering the closure of all stores of every kind other than pharmacies and food stores. Think about what the Italian economy is going to look like within days. The upward curve of the outbreak in Italy, just looking at the raw numbers there, shows you why the government there is taking these severely draconian measures, right? But the upward curve of the epidemic in Italy is also a cautionary tale, particularly for us, about what exponential growth really looks like in an epidemic where the virus is such that every infected person, on average, is infecting 2 to 3 others. The math with an epidemic like that is terrible. It's devastating. I mean, look at Italy. January 31st, Italy had 2 people known to be infected. Within a week, February 6th, that had risen to 3 people. 2 weeks after that, they were up to 17 people. 3 days later, by February 24th, 219 people. 4 days later, February 28th, 821 cases. Just over a week later, March 6th, 3,916 cases. 4 days later, as of yesterday, it's 10,149 cases. That's yesterday. Today, it's up 12,462 cases. I mean, that's the epidemiological mushroom cloud exploding in Italy. And, you know, it's not like Italy has had its head buried in the sand. Italy closed schools. Italy canceled large gatherings. Right, we saw those dramatic pictures of Italy playing sports matches in empty stadiums. They did it. They did tinker around the edges with all of these here and there interventions as they saw their numbers starting to rise. Well, now Italy is in a nationwide border-to-border lockdown as they try desperately to at least slow the spread. Imagine an order in this country to close every retail establishment in the country that was not a pharmacy or a food store. That's the order from the Italian government tonight in a nation of 60 million people. And every country is different, and surveillance methods are different. But the virus appears to be behaving the same pretty much everywhere. And so we can see the pattern of how the virus spreads, how numbers go up. I mean, look at Washington State here in the U.S. February 26th, they had 1 case. A week later, March 3rd, they had 31 cases. The day after that, March 4th, 43 cases. Less than a week later, March 9th, 166 cases. That was 2 days ago. Today, there's 366 cases and climbing. Washington State announcing 5 new deaths just today, all associated with nursing homes and long-term care facilities. We spoke with Washington Governor Jay Inslee here on the show the other day, and I asked him about the, at that point, 100-plus cases in the state. And he said, yeah, epidemiologically, we think what we've probably got is closer to 1,000 cases, which means within 7 weeks, we expect Washington State to have 64,000 cases in that one state. In the United States more broadly, we don't know, because our government still hasn't gotten it together to test people at any noticeable level, still. South Korea has been testing 10,000 people a day since February. We found out about our first cases around the same time that South Korea did. They're testing 10,000 people a day and have been since last month. We still haven't tested 10,000 people total. Over the entire course of this epidemic in this country, we've got more than 6 times their population. So imagine how big our mushroom cloud can get. But the federal government, the Trump administration, botching the rollout of testing for this virus, it continues to set the United States apart. FT, the Financial Times in London today, put out this graph showing how well various countries are doing in terms of testing for the virus. Testing, of course, a first crucial step in identifying cases, isolating and treating people with the virus, tracing their contacts to stop the virus from spreading further. And you can see, South Korea at the top there, absolute rock star. But look where we are on this. I mean, the only reason France is even below us on this graph is because they're only publishing the rate of testing they're doing every day, not the total cumulative number of tests they have done. France says they're doing about 1,000 tests a day, which actually puts them way above us. We should be so lucky to get anywhere near that kind of a pace. And we're a country of 320 million people that's already got over 1,000 cases and dozens of deaths. But even with basically zero usable information on the size of the American epidemic because of next to zero American testing, because of the failure by the federal government on that front, the numbers we do have are still bad. They're still rapidly trending upward. I mean, from the publicly available data that we've got a week ago, we Americans were at 160 cases. Over the weekend, we were at 545 cases. As of today, we're at more than 1,100 cases. And again, that's just what's known. That's just from the sliver, the tiny, tiny sliver of people who can manage to get tested. The attending physician of Congress and the U.S. Supreme Court told Senate staff yesterday in a closed-door meeting, first reported by Axios, since confirmed by NBC News. Attending physician of Congress told Senate staff yesterday he expects that at the end of the day, ultimately, the number of Americans who contract coronavirus will be in the range of 70 million. 70 million at the low end, 150 million on the high end. Which means if it continues to be the case that 15 to 20% of people who get this virus end up seriously ill and potentially needing hospitalization, if those estimates are right, that would mean we'd be looking for hospital beds for somewhere between 10 million and 30 million Americans. 30 million people requiring hospitalization for serious illness? On top of all the other things we need to use hospital beds for in this country? 30 million people? 30 million Americans? I mean, and the kinds of serious illness that you get from this disease. I mean, we're talking about, potentially intensive care beds, intubation, being put on a ventilator and all that. 10 to 30 million people? Do we have the capacity to do that? If we know now that that is what's coming, how do we even start to create the capacity for that? After the Ebola crisis in 2014, President Obama created something called the Directorate for Global Health Security and Biodefense at the National Security Council. It was basically pandemic preparedness as a White House office. President Trump got rid of it. Fired the guy who was running that office, fired his whole team. Got rid of him, didn't replace him. Got rid of the whole global health security unit at the National Security Council and at Homeland Security as well, and even at the Pentagon. These global health security teams existed. They were put in place for a reason. The U.S. government had seen fit, because of the experience with Ebola and other novel challenges, to set those things up inside the federal government so we wouldn't be starting from zero. So as to prepare us for a moment like this. President Trump inexplicably, affirmatively moved to fire those people and get rid of that function of the federal government for reasons that remain unclear and unexplained even this far into this current and absolutely petrifying crisis.